All right, so again, my name is Natalie Mitchell, and I'll be leading through today's presentation on an introduction to AI-PAMI and our resources. And so an introduction to our AI-PAMI team here. So we are housed within the UF College of Medicine, Jacksonville. I'll go over exactly what that looks like here in a minute. But our basic team, we are run by 2 emergency medicine physicians. So Dr. Phyllis Hendry and Dr. Sophia Shake that you can see pictured on the screen. And they enter into some different grants in order to fund projects that are related to pain management. That is their specific area of interest. So they not only have a couple of education-based programs, but they also have some research studies as well. And this is the specific focus that they have in addition to being emergency medicine physicians. Dr. Sophia Shake also leads the Poison Information Center, which is housed here in Jacksonville. And then we have Dr. Jennifer Brailsford. She is a social scientist, so she helps us a lot with our planning for the program and the focus group portion of things. So when we're going through all of our qualitative feedback, so we do an interview call, we have lots of transcripts and information to go through. She leads more of the research-oriented portion of this project. And then myself, Natalie Mitchell, pictured on the right here. I am the program manager, if you will, so I help to really coordinate the different events and webinars and help to get people acquainted with all of what we're doing with this AI-PAMI program. And in addition to those that you see pictured here, this is just our core team. We run the day-to-day happenings of this program along with a few others, but we also right now currently have 26 different presenters who have spoken either live or done recorded presentations for us. So we really have a diverse number of experts who have lent their expertise and all of their resources to helping us bolster and improve our topics related to this program. And a little bit more about myself. So I am a certified health education specialist, and I have a Master of Science in Health Ed and Behavior from the University of Florida. I have worked for UF Health Jacksonville, the Jacksonville arm of the UF Health hospital system since 2018. And another side note, if you attended the chair yoga class, you might have noticed this before, but I'm also a registered yoga instructor. I have my RYT 200, so my 200-hour training certification for yoga. And I help again to organize and coordinate these different webinars and events as well as our recorded programs. So I'm always looking for resources and trying to connect with older adult groups within the counties that we serve. So that includes all of Northeast Florida, not just those in Jacksonville, but really branching out to the counties that touch all of Duval here. And originally, when I was hired, this program was meant to be in-person courses, and that has obviously changed. So if you've attended our webinars, you know we are online, at least for the time being. And then again, just a little bit more into the technical parts of us. We are funded by the Florida Blue Foundation. So again, a grant-funded program. We offer educational events. So we're not a clinic. We don't provide any sort of actual interventions. We don't touch patients with what we do. We simply educate. And then we help people to consider some of these different options and maybe start a conversation with their healthcare provider or vice versa to get the healthcare provider to feel more confident in talking with their patients who are 50 and older dealing with painful conditions. And so we really are geared toward those 2 target audiences only. So the older adults, 50 and older within this region, sometimes beyond, of course, we know online, anyone, anywhere can attend these events, and then healthcare providers. So anything from nurses all the way to anesthesiologists. We're interested in having anyone and everyone interested in integrative pain management options attend our events. And our website is listed there. That's our main website for our PAMI program. And we have our phone number and our email address there. It's a group email. So if you ever have questions, anything that we can help you with, if it's not something that we can answer for you, we will definitely direct you to someone either within our hospital system or affiliated with us that can help answer your question. And so again, our team is housed at the UF College of Medicine, Jacksonville. For those of you that don't know, and maybe you've lived in Jacksonville, maybe you're unfamiliar with it, but we have a UF presence right here on 8th Street in Springfield. This includes the College of Medicine, the College of Pharmacy, and the College of Nursing. And we're all housed within this, what we call our downtown or Springfield campus, and that's where our program is housed. So there's just a few of us that help to run these grant-related programs. Again, we're not a physical clinic. We don't offer any services specifically with AI-PAMI, just education. And we also have, of course, our North Hospital, some of you all might be familiar with, and primary care locations throughout the city. So that's who we are. We're housed within this larger health system. And in looking at the why, so why are we doing this? Why did the doctors who I work for decide to start this program? So we know that pain is very common, and especially in older adults. As we all age, we know that either the activities that we've been doing throughout life, whether that's fun things or job related or health conditions that we may acquire or that come up throughout life and aging, they tend to crop up as we get older. So it's very important that we keep up with all of the information that's related to learning more about the long-term effects of solely relying on pain management plans that involve just medication. So whether that's opioids or chronically taking aspirin or things like that, we know that relying on medications alone is simply not going to work for the majority of people. So our program is really trying to get at the different health conditions that maybe cause pain and become more common as we age. And we do that through offering information on diverse pain management options. So we know that the more tools that you have in your toolbox, so to speak, the more self-management options or the more integrative understanding that you have, you'll be able to maybe feel a little bit more hopeful about some of these different things that you can try rather than solely relying again on the medication-based route. And we know, of course, that there is evidence behind some of these mind and body practices. And this has, of course, come to light. There are the National Institutes of Health. There's a whole complementary arm of that. So many academic hospitals and universities are studying things like yoga, Tai Chi, Qigong, and a lot of other mindfulness, movement, and relaxation-based integrative options. So the evidence is definitely growing. And traditional medical education does not cover these types of techniques often for the healthcare provider perspective. So when you think, oh, you know, my doctor has never spoken with me about this, it may just be that they have not had any formal training. So they might be aware of a topic. They just might not know how to approach speaking with a patient about it, having no formal knowledge about it themselves. So we're really here to try to help get doctors the information so they can answer your questions and help to equip you with that information so you can have these conversations in a thoughtful manner. So we're all about educating, not only for awareness, but also on the older adult side to support self-management. And so there are a lot of things that you can do at home, and a lot of the topics that you'll see that I'll talk about here in a few moments really relate to that. So a lot of these options can be done at low or no cost, and that's of course important. And the UF experts that we have, as well as our outside experts, help to vet the content that we share. So you can always be sure that we have an evidence base behind the information that we're sharing. So we like to look at this as marketing content and information versus trustworthy information. And that, of course, is important because, you know, once you enter the internet and you type in a topic of any kind into Google or Bing or whatever browser you like, that you're going to find a lot of information out there. Oftentimes, people are offering cures or a resolution to a health issue, and that might just not be true. There is really no panacea for these things. Rather, it's great to have options so that you know, okay, well, this isn't working for me today. What other options out there can I try? Rather than saying, here's your cure-all, fix-all. We are looking into, you know, a more realistic way of identifying the different things that you might be able to find useful. And I will pause here because we did get a question about the URL. So if you want to explore our website as I'm speaking here, definitely feel free, and then I'll start to break that down in just a moment. So I'm going to go ahead and pop that into the chat box if you do want to just open it up. That way you're able to bookmark it right now. That should show up in everyone's chat box if you check that out. All right, and then of course you're probably, maybe you've heard of integrative, maybe you think you understand what it is. So I want to break that down for you before we go into what the different topics are. So integrative, over time, this type of integrative medicine or integrative health has been referred to as complementary. It's been referred to as alternative, but really most providers and entities recognize that the term integrative is inclusive, so it combines all of these different things. So it's not alternative to traditional medication. It's not saying to avoid, any sort of regular routine procedures, surgeries, medication. It's saying that we can do all of these things in tandem together for whole health. And then again, also complementary means, a little bit more in addition to the work you're already doing. That's simply what that means here. It's a holistic way of looking at things, and it encompasses all parts of what it means to be a human person. So the mental, emotional, financial, all these social aspects that go into our health, rather than just looking at one health condition or pain specifically. And it's a really big picture way to look at things. That's the way that we like to explain it. So that way you can understand when we talk about some of these integrative topics, why we're going this route. So it might not get at all parts of a health problem or pain, but it's going to get at one of those aspects. It's going to help to reduce and lower pain, stress, or anxiety that's related to pain. And so the benefits, of course, it may be helpful, and it's been studied that a lot of these different options used alone or in addition to traditional treatments can help to maybe reduce reliance on things like opioids or other medications. It can reduce procedure times, because if you lower stress and anxiety, when that's related to, procedures involving needles and more traditional surgery, it's been shown to help increase somebody's ability to handle that a little bit more mentally and reduce the amount of time spent in recovery. So things like the length of stay then decrease, adverse events, because you've already been starting some of these prevention type measures. And then also a number of systematic reviews. So these are research studies that look at other studies. They look at a specific topic and they group all of that related research together and analyze the evidence base that's there. The potential benefits of mind and body approaches are really helpful for symptom management for pain. So again, when this is used in addition to some of those other things that your doctors might already be recommending to you, it's going to help to create a more holistic and realistic pain management plan for you. And so we know that there are really good safety records when we look at the research. Serious side effects from any of these options are very rare. There have been only a few reported with acupuncture and a couple of similar things. Of course, that's a little bit more invasive. The needles are hair-like and thin. However, there's always issues that might come with penetrating the skin and things like that. So overall, good safety record. So low risk of side effects and issues. That's what we want to look at first as far as pain management. And then you can layer on things that might be a little bit more higher risk with the help of your different providers. And also these non-pharm options, again, a lot of them can be performed at home for little to no cost, or there are providers that can assist you with some of these techniques. And so some people will say, well, what's best for this condition, or what's best for me? Well, the answer really is the options that you choose. So you have the option to create this basket full of integrative methods that you're going to try. You're looking at what fits for yourself. So your budget, your mobility, your specific interests, and the health conditions that you might have. And knowing all of these different options that are out there, you can customize and help to tailor that for yourself and be able to have some control there. And so knowledge is power, and we believe that this kind of information is going to help you to start the conversation and maybe feel a little bit more comfortable asking a healthcare provider about it. And what does this look like on our website? So of course, if you've not visited our website, this is the link again, and I will drop it once again. If there's new people who've joined us, check out that chat box. That's our URL. And that's going to lead you to our main page. So we are a couple of web pages housed within our larger PAMI project. But for this specifically, we have our Aging with Pain series for older adults. And that clearly is one tab that has all layperson related topics. So it's going to help you practically apply information. We also have this healthcare provider series. So that's going to get more into the technicalities, the research behind the different topics, and maybe how a provider might look at a patient. It's going to be a little bit more clinically based, might not be as useful for the common everyday person, but we do have those two tracks available. And then on our website, I'll break down each of the tabs. So again, you'll see we're housed here, Aging with Pain. So you'll have an overview. If you're someone who's not already signed up for our online form, you can simply fill out your information here, and we're going to email you when we have new website content. So when we've added a new presentation that relates to you, and whether you've chosen to sign up as a patient caregiver or a healthcare provider. And we also share when new live webinars, at least for now, have been scheduled, and we're not going to spam you. So we run this program. We don't send out any other emails. It's just when we've added something new. So I encourage you to sign up for that form if you have not already. And then the next tab I want to introduce you to, because it would probably relate most to why you're joining this webinar, is our Aging with Pain for Older Adults and Caregivers tab. So this has regularly updated content, and it provides you with on-demand access to our presentations. So what that means is just simply, whenever you feel like coming to the website, you can watch the video at your leisure. You don't have to sign up for a specific time slot. Don't have to wait for anyone else. You can watch the video, you can pause it, you can come back to it, you can open up other resources on the page. It lends very well to someone who's just interested in pursuing this information on their own. And so this breaks out our current list. So if you go to our website, of course, you'll see all of these topics laid out. There's visuals, much more attractive, but this table breaks out our current topics that we have housed on our website. So if you haven't checked out some of these, maybe that we did live, the recorded versions on here, some of these were set up as a recorded presentation altogether, but these are the current topics that we have. So if there's something that you see maybe that would interest you, just know that it's on there and it's waiting for you at your convenience. And of course, part of this is that our post surveys that we're always pushing out after these events are very important, because we collect your feedback about topics you might want to see in the future. Sometimes we've already covered the topic, so maybe we wouldn't do it again, or maybe you have an interest in a specific look at something more in depth within a topic. We're pretty open as long as we can find the expert who has the time and the availability to work with our program. So I definitely encourage you to check that out. And so each of the topic pages, once you click on a topic, the one I just clicked on for this example is our newest, and it's called The Shape of Things, and it's about drawing and art making for pain management. So we partnered with a group called Arts for the Aging, and they have some teaching artists that have created these really wonderfully produced videos that help you take a look at either music, we'll have some creative movement ones coming up, or in this case, drawing, as a way to help to distract yourself from the pain, but also do a little bit of internal reflection, some self-reflection. And in this video in particular, you're not only going to hear about the topic from the expert, you're also going to be led through a demonstration. And this is a self-portrait that this teaching artist is going to walk through with you so that you can do it on your own. But then they're also going to give you some other resources that you can explore. And pretty much most of our topics are set up this way. You're going to see the video. You can either watch it on our website. You'll notice it's kind of a smaller box. If you hover over the video, you'll always see that watch on YouTube link. So you can just simply click on that. You can make it full screen, much larger. The beauty of this, again, is you can pause it. So you're maybe watching this one and it says, okay, gather up pencils and a couple of sheets of paper. Pause the video, go gather your supplies, and then you can start it up again as soon as you're ready. But we've kept things very simple, easy to navigate. Most of the presentations also have a slide deck that you can download. So that's just going to be the presentation, the actual information portion of things, so that you can take a look at it later. But oftentimes the video is best because it has that audio component in addition to the slides and then the actual speaker presenting. And then our upcoming live webinars are housed on our tab called AI-PAMI Live Events. And so right now, at this point, of course, because of COVID, everything really is a webinar that we're doing or recorded content. It could change in the future, of course, when we're looking at, a world maybe that's a little bit more vaccinated and safe. But for now, everything is housed on the internet. So very convenient for you to access at your own free time. And then when we have those new events that are on a specific date, like the webinar that you're attending right now, you can register for those completely free. And then the last tab that we have is our pain management resources. So you'll see on here things like how to locate a provider of a specific kind. We've put reputable links up there to help you to find those that are certified or licensed, depending on whatever the modality is. We have some information about support groups, information for you to explore topics on your own, information about apps and other resources, some communication tools that you can use for speaking with your provider. All of those are links here. So that way you can click on those. You're going to get a lot more helpful information or some search tools to help you to identify some things that you might be able to use in your own pain management plan. And we have done this, of course, you can do some Googling on your own, but again, it's a nice, concise way to know that we've done the vetting and the digging for you. So our UF experts and friends have helped us to compile all of these, and we've done some of that digging around, weeding through some of the marketing messages for you. And so, of course, our website, again, as a reminder, is the link that's shown here. And I do encourage you to bookmark this. So there should be a way in your browser. Sometimes it's called favorite. There's a little star, or it might say bookmark, but you can add us. That way, every so often, maybe you have a little downtime. Maybe you're just wanting to try something out. You'll go ahead and visit our website and you can check out a video at your leisure. And so I definitely encourage you to do that. And then once you've looked at one of our videos, and maybe you've explored it on YouTube, but if you'd rather just look at the YouTube videos, you can go ahead and bookmark our YouTube channel as well. And then my email address is up there. So Spindle or Mitchell, doesn't matter. I have recently changed my name, but the email address is an alias. So I will get all of the emails no matter where you send it. And I'd be happy, again, to answer questions or move information to someone who can answer a question for you if you ever reach out to me. And then I will go ahead and open it up to questions. If anyone has any specifics that they would like to ask, you can either feel free to use the chat box or that Q&A feature that's located in your Zoom toolbar. I will go ahead and give that a couple of minutes. If something pops into someone's head, of course, just let me know. But we will definitely be sending out the recording for this event to everyone who has attended, along with the post survey. And I'll probably just share a few more resources, again, just all links to our website so that you can explore this on your own and spend a little bit of time maybe checking out a topic of interest to you. We definitely encourage you to fill out that post survey because you're going to be able to tell us about a topic maybe that you want to hear more about. And if I can answer any questions, again, just use the chat box or that Q&A box and type out anything you'd like to ask. Okay, so our YouTube channel, I will go ahead and drop that in. We just got a question about how you locate that. And I'm gonna go ahead and drop that in here for you. A way to navigate that, let me do a new screen share so you can see my full screen. So I just had gone to our website. Again, when you go to our main PAMI website, it's this lengthy URL up here. We're all within this Aging with Pain tab. So once you click on that, I will go to our older adult series. And I'm just going to click on this one, for example, but you can see all of them will have a video like this. I'm going to select to watch on YouTube. This is just one way to get to it. You can always go on YouTube and search for us. So pause this. And we are University of Florida Emergency Medicine Research is the channel. And then we have a specific playlist for our older adult program. So I'm going to go ahead and drop that link in for you all. So this is in the chat box. And you can see that link there. If you save that, that's going to bring you to our YouTube channel with all of those videos together. So I hope that that is helpful for you. And then you can see that on the side. If you're not used to navigating YouTube, definitely recommend it. You'll get used to it. It's pretty helpful. You'll start to see videos of similar topics on the side. It's going to continue to get to know you as you use it. But for our channel, you're going to see all of our videos lined up here within this playlist. So it's very helpful. And again, once you use YouTube a little bit more, you're going to start to see related videos. These are just music and topics that I look at a lot over here on the side that pop up for me. But just go ahead and bookmark us, save it in Chrome. It's just a little star up here to bookmark it. Definitely encourage you to do that. And if there are no other questions, then we can go ahead and conclude. But again, I'll look out for that email with the recording, and then we'll go ahead and send out some additional links, and we'll definitely get that post survey out to you all for you to input your feedback and provide us with any topics of interest. And I do appreciate everybody for joining us today. So just make sure that you reach out to us with any questions and we'd be happy to answer. But otherwise, I hope you have a good afternoon, and thank you again for joining our AI-PAMI webinar.